So my name's Adam Galloway. I'm a children's physio at Leeds Children's Hospital, and I've also got one of the NIHR ICA pre-doctoral clinical academic fellowships. So my top tips for anyone considering getting involved with the ICA programme is, first off, do it. The key tips that I would give anybody is make sure you've got a supportive team, both in your clinical setting and academically. Don't rush an application just to get them in. Try and find the supervisory team that's going to help you make sure that your application is the best it can be. Make sure the project is yours. Make sure it's something that you love and you don't mind doing even when it gets tough, because that's what's going to be the difference. And the other key tip is make sure that you definitely have a real life outside of clinical academic life as well to keep you sane. There has been challenges in the research career. I think a lot of it comes from a very busy NHS, a very tested NHS, and without backing of people like the NIHR, clinical research is really, really difficult, especially for non-medical professionals. We need that backing. We need these types of fellowships to protect our time, to be able to do it. And ultimately it's a win-win, because this time that you spend going and doing the research means that you get better outcomes in a clinical setting. So I think that's the biggest challenge, is balancing that clinical academic relationship and knowing that you need to know who your supervisors are, you need to know how to speak to them and how to approach them. And that comes from getting help from other people to do it. So I think the NIHR and the ICA programme is an amazing way of getting involved in clinical research. As a clinical academic, it's not just about getting involved in research, it's about staying in research and developing in research. You develop in a clinical setting, you develop in an academic setting, and both of those things are leading to better care for patients, better outcomes for patients. And I would just really encourage anybody who is thinking about getting involved to speak to whoever they can, whoever they know, who's had a small taste of it or a big taste of it, whether it's the professors at your university or whether it's the physio that's just finished an internship in your ward.